This is Mon Health Talk, a weekly program focusing on the dedicated physicians, nurses, and staff at Mon Health, the region's premier community hospital system. People with skillful hands and bright minds using state-of-the-art technology. We don't just practice medicine, we care for people like family. That's why at Mon Health, you can feel the difference. Once again, welcome to this edition of Mon Health Talk.
Hey, good morning. Welcome into the program. Dave Wilson and Sarah Giosi with you. Joining us in studio this morning, Dr. Carl Barosso, Cardiothoracic and Vascular Surgeon at Mon Health Heart and Vascular Center. I got it out the first time correctly, Emily. I see you snickering over there. Good morning, Carl.
Good morning.
How you doing, buddy?
Pretty good, pretty good.
All right, we're going to jump into a couple of different subjects this morning. Clearly, going to be dealing with the heart. I mean, that makes a whole lot of sense there, doesn't it? But as we usually do, we got to make you go through the gauntlet, and we got to go through your whole background and bio. We'll start as a young child. No, I kid. Just give us a little background. Where you come from? How'd you end up here in Morgantown at Mon Health?
Well, originally I was born in New York City and left New York to do some further training down in Houston as well as Chicago, and been in the Wheeling area practicing medicine. Talked to some people down here at Mon Health as they were looking to expand the services for vascular as well as cardiothoracic, and wound up down here.
So what piqued your interest, as a medical student you're going through, and what piqued your interest in cardiothoracic and deciding to go into that specialization?
Well, my mom was a registered nurse, and that was an early entry into medicine. After finishing medical school, went into general surgery and actually did vascular surgery fellowship first down in Houston. But as part of that requirement, I was helping out with the open heart surgery program, and after finishing the vascular surgery program, I went back into a cardiothoracic fellowship up in Chicago.
Sarah, how you doing over there?
Good morning.
I totally forgot to say good morning to you over there. I just jumped right in today.
Well, good. No, we need to. Let's do it. Let's talk about it.
All right, we'll continue. Let's get back to the subject then.
Yes.
Now we get the pleasantries out of the way.
Yes.
Here in West Virginia in particular, how big of an issue is heart and just the entire cardiovascular health of the state? I would imagine we're not doing so well. Or maybe we're doing better than I think.
Well, if it's a 30-minute program, it's probably not long enough to really get into it. But, I mean, obviously, many of these local area states have their own issues. West Virginia is sort of not so much unique, but as in surrounding states have similar issues. Nicotine addiction, one of the biggest issues. Obesity, second issue. Cardiac issues, vascular problems, very big issues in the state.
You know, I was just seeing, I think just a couple weeks ago, they redo every couple of years the study on who in the country has the highest rate of obesity. And we used to always at least have Mississippi. We were usually 49th.
We're number one now?
We have moved to 50th, yes, unfortunately. So and
top of the rankings.
Again, well, I guess that's one way to look at it, Dave.
It seems to have always bounced back between number 1 and number 49 and 50 all the time.
Yeah. So, I mean, that's got to play a role in your day-to-day work here, as you were just describing, obesity being one of those major factors.
Obesity is just one of the biggest issues around here in terms of cardiac disease. Again, it just leads into so many other categories, but also nicotine addiction.
Mm-hmm.
What are some of the contributing factors, particularly here in West Virginia, and if you really want to zone in, particularly here in North Central?
Well, I mean, there's so many factors. Some you can control, some maybe not so much you control. We don't have the whole recipe of what contributes to cardiac disease and peripheral vascular disease. I mean, obviously genetics plays a big part. Smoking plays a big part. Obesity, lifestyle, the diet, the nutritional component of that. So as diabetes goes with the obesity. So all these things are a mixed bag, and there's only a certain number of things that we can actually work with the patient. Hypertension, extremely important.
All right, we're going to talk about some of those things that you can control on your end. Also, on the doctor's end, we'll also get into some of the differences between cardiothoracic surgery and vascular surgery, because there's a difference.
I always learn so much on these shows. I do.
We usually do. We're talking to Dr. Carl Barosso. He's a cardiothoracic and vascular surgeon at Mon Health Heart and Vascular Center. We'll continue the conversation next. It's Mon Health Talk on WAJR. Dr. Carl Barosso, got it right one time. That was it. Cardiothoracic and vascular surgeon. Emily's now smirking at me.
I was actually going to make a joke about because I was going to come in and say cardiothoracic, and I was practicing it in my head.
Yep.
And I thought, well, I can't do worse than Dave.
Nope.
But then
You
I didn't
sure
even have
can't.
to make the joke.
Sure
because...
can't do worse than me. Just
all right.
let's move on.
Let me take it from here. So right before we went to the break, we were alluding to the fact that there's a difference between cardiothoracic surgery and vascular surgery. Can you help define that for us a little bit?
Sure, be more than happy to. Cardiothoracic surgery basically deals, as the name states, the heart as well as the lungs, and the structures probably, I guess, best defined by above the diaphragm and below the neck, sort of like the strike zone in baseball.
Okay.
Vascular surgery is an entirely different field, which will develops over the years into the structures involving the arteries as well as the veins, diffusely throughout the body. It could be in the intestines, it could be in the lower extremities, it could be the arteries in the neck that entail in vascular surgery.
Well, what kind of conditions do you treat whenever it comes to vascular surgery then?
Oh, it's a whole
mess of stuff.
A whole textbook of conditions. Specifically in the neck, mostly we deal with the carotid artery. Many people have a significant amount of carotid artery disease, which can be a prelude to stroke if it's not treated appropriately. Down in the abdomen as well as in the legs, there's different types of disease specific for each area. In the belly, we often see two types of disease. One is aortoiliac occlusive disease, which means blockage of the main arteries in your abdomen going down to your legs, or an aneurysm in your belly. And that can be treated one of two ways nowadays. The older way, I guess, is always tried and true, is an open operation, and newer techniques have made to minimally invasive surgery where we can treat them with stent grafts. In the legs, we have, again, many different types of diseases, but arterial diseases are blockages. Blockages in your leg, people who, what we call claudicate. They walk a certain distance, and then the legs get tired, cramp up, and you can't walk any further.
We had talked earlier about obesity rate and the fact that heart disease and just issues of these sort of things that we're talking about today are pretty prevalent here. So maybe that's the answer, but on top of that, why is it important to have a vascular surgeon at our community hospital?
Vascular surgery, like I said, has been expanding its role in terms of patient care, patient intervention. In the community hospital, it's important to have choices. You want to know that you can go to that hospital and still get treated appropriately and not have to travel to a larger center. We provide, I think, a very good service for the people. What we do, we try to do very well. We don't do everything, but what we do, we try to do the best we can.
How does cardiothoracic now factor into this? You kind of said, you gave us the visual of the strike zone there. So what kind of conditions are you treating most commonly?
In the cardiothoracic department?
Yeah.
Heart disease, coronary blockages. You hear people had a heart attack, etc. A valve disease. We do multiple valve procedures. Dr. Nagy, my associate, has done many TAVR new valve implantation devices, as well as lung disease. Unfortunately, as I said, smoking is very prevalent, and unfortunately, many people have lung nodules. Sometimes they develop into a cancer, and one of the ways we can monitor that is with chest x-ray and CAT scan, and then they need further workup. So we can offer services regarding lung diseases also.
How far have these procedures progressed in the last 10, 15 years? Because when people hear they got to go see a cardiologist or a heart surgeon or a vascular surgeon, they automatically assume the worst, think the worst. But I would venture to guess we've come a long way from when Granddad had to go see the heart doctor, if you will.
It's so much has changed over the years. There's so many new things on the cutting edge of patient care. Regular coronary bypass has progressed to become, as I would say, maybe fine-tuned. It still involves an incision in the chest. It still involves a heart-lung machine. Valve disease has really made many wonderful strides to move forward. Back in the day, we still had to open up the chest, open up the heart, and replace the valve. Nowadays, most of the time, or I should say maybe just many times, we can replace that now with a percutaneous option, where we actually make maybe a small incision or even no incision in the groin, place a catheter into the heart, and they place a valve there and save the patient the whole morbidity of an open chest.
That's amazing.
Yeah.
And that, to me, because actually a friend of mine is going through this, had an open heart surgery, and he has had, I think, 9 months of complications from the wire that sewed him. I won't get into all the details of that, but it's been 9 months of complications. What you just described would seem to avoid all that if that's an option for you.
Every case is individualized, especially with the valve cases, but many of the valve patients go home the next day. maybe 2 days.
That blows my mind.
Yeah, I mean, you can carry that down into even aneurysms. There are what we call thoracic aneurysms, which are basically a dilatation, a ballooning of the main blood vessel, which is maybe the size of a garden hose in the chest and abdomen, and it enlarges over the years, and now we can put stent grafts also into that. Whereas before, you would have a very morbid operation in terms of opening up your chest and operating directly on the artery itself. That option even continues into the belly, where we have what we might term as an infrarenal aortic aneurysm, which is also ballooning of the aorta, and most people are candidates to have this newer procedure done.
You know, we hear so often on this program, whether it's, any of the doctors who come in really, about procedures and this importance of getting the patient home. We can get you out in a day or two. Why is it important for patient recovery, whether you're having any of these procedures done, to get them home, to let them recover at home versus staying in the hospital 3, 4, 5, 6 days, whatever it may be?
Patients on the recovery, I mean, who would want to recover in the hospital when they can do the same things at home? I mean, hospital food, everything else, it's the way it is. I mean, but you're more active at home. You're more inclined to get up, go to the kitchen, more inclined to walk around, and instead of just lying in bed watching television. And when you lie in bed, you're not using your muscles, you're not breathing, taking those deep breaths. You may be more predisposed to other complications such as pneumonia and things like that.
You seem like a nice guy. You seem like a fun guy. How can I
Got him
avoid
fooled.
How can I avoid coming to see you, period?
Well, judging by your coffee you're drinking, and I don't know if you can avoid it.
Wait till you see my
I'm
lunch.
gonna pencil you in for next week right now.
Hey, I tell him that all the time.
Yeah.
I'm on him all the time.
As I said, it's my second cup of coffee myself. But how can you avoid it? I mean, obviously, all those things you hear about on television and all the talk shows or whatnot, they're very much true. Smoking, lifestyle changes, exercising, watching your weight, the choices we make with the food and things like that.
Can you be predisposed to having cardiovascular issues? Can a family history play a role in that?
Oh, definitely. Every time we see a patient in the office, we always ask what I think is a pretty in-depth history of their family regarding heart disease and peripheral vascular disease and strokes and things like that. And you see a correlation. There is a correlation well described between aneurysms and family history. But at least to know about it makes you more aware of it, is the patient had more of a predisposition to have those diseases.
But just because you have the predisposition doesn't mean you have to get it. And again, whenever we talk prevention, smoking and diet and exercise.
It doesn't mean at all you have to get it, but if you know about it, you might be more inclined to have a test done. Mm-hmm. And the way the testing is done nowadays is quite amazing. I mean, it's just so much of it is non-invasive, especially for the peripheral vascular standpoint. For cardiac, you still have to have certain types of tests, nuclear studies tests and whatnot. But for the peripheral vascular, ultrasound has really opened up the door for what we call easy testing.
Mm-hmm.
You know, Sarah, I'm really going to feel guilty when I have that cheeseburger for lunch later today. Yeah. Just want you to know. Hey, we're talking to Dr. Carl Barosso, cardiothoracic and vascular surgeon at Mon Health Heart and Vascular Center. We'll continue the conversation after this. Mon Health Talk on WAJR. Dr. Carl Barosso joining us in studio today. Is that close? I totally butchered it going into the break, didn't I? That's okay.
It's fine.
It's all right. I know I did. Emily's over there like a good representative pointing that out.
She's in your corner.
Yeah, right. She's in my corner. We've been talking about cardiothoracic surgery and vascular surgery here this morning. Are we going to contact you directly, or are we going to get a referral from our, primary care physician or maybe another physician somewhere?
The way medicine is nowadays, you're going to need a referral from the primary care physician because it has to be pre-approved and all this kind of thing. So
for insurance reasons.
For insurance reasons, exactly.
So we go to our primary care physician. We talk to them about the fact that we think that we could use a referral, or we talk to them about our family history and ask to maybe get some of these screenings you're talking about. Then what? Where can we go if we want to find out more?
Well, I mean, we're available in the office. If your primary care sends you over to our office, we'll gladly talk to you about more in-depth things.
Great.
You can always go to the Facebook page.
I also, and there's a whole separate section, monhealth.com/heart, I believe. You can go and get some more information too, which is good because, again, if somebody's maybe missing this show, but they're thinking, oh, I heard the show today, but I didn't catch all of it. Or they're thinking, oh, I've got somebody that should definitely go and check this out. Then they can send them to that website to find out some more of this information, because I know there's even things there about warning signs and prevention and all of that too. Or you could just see it on YouTube, right? Aren't we on YouTube?
Yeah, we get the video up on YouTube.
Yeah, we are so fancy.
High tech around this joint. Not as high tech as these guys over there.
Right.
Hey, where are your office located?
We're at 1200 J.D. Anderson Drive, 3rd floor. I'm in the office, in the cardiothoracic office with Dr. Kim and Dr. Nagy.
Is that tough, having to share an office with them?
Oh, no. They're good people. Also, just when you're talking about where else can we find out more about the disease, just because you come to us doesn't mean you're going to get an operation.
Oh, yeah. I'm glad you said that. Don't be afraid to come in, right?
Exactly.
Yeah. Are there a lot of steps you can take to avoid that? Or I guess my question is surgery the last resort option? If you can do it without doing the surgery, do you try to go that route first?
Again, it's all individualized. It depends on what disease process we're talking about. Are we talking heart disease? Are we talking carotid disease, leg disease, things like that? But most of the time, many times, we can at least start with a non-invasive procedure.
Just want to point out, because we talk about this all the time too, Sarah. How many times has he said individualized today? It's not a one-size-fits-all. We talk about that all the time with Mon Health. No matter what the subject is, each patient, you're going to come up with an individualized plan.
Different. Every patient is absolutely different.
No one-size-fits-all cure. Although that would be really nice for the purposes of this program, by the way. Just give us one-size-fits-all answer, but that's certainly not the case. You're going to evaluate and find out what's best.
You have to talk to the patient and find out and really tailor their treatment plan for them.
Hey, what do you enjoy most about this job?
Just the patient contact, the fact that you can help somebody.
I hear that from a lot of doctors. They enjoy the interaction with the patients. And, did you get people who come back and say, hey, doc, you saved my life?
Yeah, sometimes they'll come back and they'll actually shake your hands and be grateful. They're good people.
Does that feel good?
Yeah, it does.
It's got to, yeah.
We don't get that much in radio.
No.
Not very much at all. Hey, well, thanks for coming in this morning. I know Emily had to kind of coerce you to get in here this morning.
No
I kid. No, I appreciate you coming by.
Oh, my pleasure. Anytime.
We did mention the YouTube. You can see the video of this program. We also have the podcast as well. Let's see. For, again, more information, monhealth.com/heart. Of course, you can check out the Facebook, Instagram, Twitter, LinkedIn, all there as well. Coming up, we've got the top of the hour, Fox News Local News, and Talk of the Town on the way next. It's been Mon Health on WAJR.